most common condition what we see in our children's orthopedic clinic is actually related to the way children walk. Quite commonly, children presents with in-toeing gait. Hi, I'm Mr. Umar. I'm a trauma and orthopedic surgeon based in Cheshire and Manchester. I specialize in lower limb surgery and also in children's orthopedic surgery, dealing with children between the age of 4 and 16. Children's orthopedics is a very interesting topic as children are very unique individuals. They've got some differences in terms of their skeletal development and growth when comparing to the adult population. They've got growth plates which can have its own challenges in terms of while they're growing, and also the certain conditions which can affect it. And also their presentations can be very challenging for the parents as well. So in my area of expertise, today we are going to talk about certain presentations where children can present to an orthopedic surgeon for different scenarios. Most common condition what we see in our children's orthopedic clinic is actually related to the way children walk. Quite commonly, children presents with in-toeing gait, which can be just a normal variant for certain children, and most of the time in-toeing gait does correct with age. And we just need to kind of have a watchful observation to make sure there is no condition related to this presentation which needs any intervention. Quite commonly, it is related to certain angles in the hip joint, which gradually corrects over time. By the age of 8 or 9, we do expect it to self-correct in majority of the children. Very rarely, children with their hip area rotation issues will require any surgery to correct the orientation. Other conditions leading to in-toeing gait may affect the version mean rotation of the lower limb is the shin bone, and also sometimes certain postures of the foot can lead to in-toeing as well. Again, actually, majority of the time these conditions do resolve with time. We just need to observe them and let the children grow out of it, but rarely they will require surgical intervention. And healthcare professional can observe and review children in a way to make sure actually their progression is as expected for their age, or whether they will require any surgical intervention at some stage. Other common presentation by children of this age can be either pain while actually they are doing some activities, or even at rest as well. Quite commonly, when the children actually are in kind of having a bit of a spurt of their growth, they can actually start what we call growing pain, which essentially involves children's rest rather than activities. Like most of the time, they will complain of pain at night time, usually not much actually during the day. So again, that condition can be a bit challenging and concerning for the child or the parents. But most of the time, actually just needs some observation or use of analgesics as and when required. But if child has a pain with activities, that actually will need some more looking into more further clinical assessment and maybe some investigations as well. Particularly in adolescents, we see presenting with either actually their sports-related injuries, because they're getting more and more involved into sports at that time, and commonly they can present with the groin pain or knee joint pain. So those areas will need to be looked into in detail further by their clinical evaluation, and also by further investigations to see what exactly is happening, whether that is related to any particular trauma, and whether they will need any particular treatments. Again, most of these sporting injuries are dealt with physiotherapy rehabilitation, use of analgesics, modification of activities. Sometimes we have to use some bracing, and occasionally they will require surgical interventions as well. Here comes the role of a specialist orthopedic surgeon to evaluate your child and make a decision accordingly. Sometimes there are certain conditions like Perthes disease or slipped capital femoral epiphysis. These are the conditions affecting children between the age of 5 and 12 typically. And children can present with a new onset history of limping or pain in the groin. And sometimes they can have kind of leg length discrepancy as well. So again, actually, if these symptoms are present in a child, they will need to be evaluated by a healthcare professional on a sooner basis to have further clinical evaluation, maybe further investigations in the form of certain scans, and to decide actually further management, as these conditions sometimes do require surgical intervention in a timely manner. Other conditions can be related to children's posture, and sometimes children present with the way they walk is not normal as it used to be, or they started having back pain. That can be related to diagnosis of scoliosis, which essentially is a curvature in the spine, which again, actually, it's a common presentation in adolescent children when actually they're coming to the close to their skeletal maturity age, and they are actually growing much more faster. So sometimes it can be just actually related to their growth, which just needs observation, but occasionally scoliosis or curvature of the spine can be related to some other underlying conditions, which will require further evaluation and maybe investigation. And very rarely, if scoliosis is quite severe and starts affecting significant functional activities or persistent pain, they may require further intervention, which may be in the form of use of braces, or sometimes they have to go for surgery as well. So children can present a bit differently, and actually their response to the injuries, their response to certain skeletal conditions can be different to adults. So they do actually need evaluation, but good thing is majority of the time children's presentations can be managed without any operation, but still they will require a close eye by a healthcare professional who deals with these things on more routine basis, so that they can be evaluated in time and dealt with if there is a need for any intervention at any stage.